The antiseptic smell hit them first sharp, chemical, nothing like the herbal remedies or incense they remembered from home. Rows of Japanese prisoners shuffled through the entrance of what the Americans called the infirmary, their bare feet silent against polished linoleum floors that reflected overhead lights with mirror-like precision. Most had never seen such brightness indoors, such gleaming surfaces, such an abundance of white cloth and metal instruments arranged with surgical precision. The building itself defied their expectations. Where they had braced for crude field medicine, bandages torn from rags, operations performed with bayonets, they found rooms that sparkled like temples, filled with machines whose purposes they could not fathom. Glass cabinets lined the walls, packed with bottles of pills in colors they had never seen, liquids that glowed amber and blue under the electric lights. The Americans in white coats moved with calm efficiency, speaking in low voices as they checked charts and prepared syringes. For men who had watched comrades die from infected wounds that festered for weeks, who had seen entire units decimated by diseases that Japanese field medics could not treat, this sterile cathedral of healing felt like stepping into another world. Some prisoners instinctively stepped backward, convinced this was another form of interrogation or punishment. Others stared in silent awe, recognizing that they were about to encounter medical care beyond anything their own army had ever provided. I'm so glad you're here with us for this journey into one of history's most revealing moments. Whether you're listening during your morning commute or winding down for the evening, it means the world to have you connected to this story. Let's step into the story. Strip, the American medic commanded in broken Japanese, gesturing toward a wooden bench where clothes could be folded. The prisoners hesitated, their eyes darting between the instruments gleaming on metal trays and the strange contraptions humming quietly in the corners. One by one, they removed their tattered uniforms, standing naked and vulnerable under the unforgiving fluorescent lights that revealed every rib, every festering sore, every mark of prolonged suffering. The first prisoner approached the examination table, his bare feet slapping against the cold linoleum. The American medic, a young man with steady hands and wire-rimmed glasses, placed a cold metal disc against the prisoner's chest. The stethoscope was alien technology to men accustomed to Japanese field medicine, where diagnosis meant looking at a wound and deciding whether a soldier could still fight. The prisoner flinched at the touch, certain this was some form of interrogation device designed to extract secrets from his heartbeat. The medic moved the instrument across the prisoner's back, nodding as he listened to sounds only he could interpret. Then came the thermometer, slipped under the tongue with instructions to keep still. The prisoner's eyes widened with terror, convinced the glass tube contained poison that would seep through his mouth. When it was removed moments later, and the medic simply noted numbers on a chart, confusion replaced fear. What kind of enemy bothered to measure a captive's temperature? The X-ray machine dominated one corner of the room like a mechanical beast, its bulk and strange angles defying comprehension. When prisoners were positioned between its metal arms, they trembled, certain they were being prepared for execution by some sophisticated American torture device. The machine hummed and clicked, producing ghostly images of bones and organs on sheets of film that the medics studied with scientific intensity. For men who had never seen their own skeletons rendered visible, the experience bordered on supernatural. Blood tests followed, needles piercing skin to draw crimson samples into glass vials. The prisoners watched in fascination and horror as their life essence disappeared into tubes that were labeled and carried away to mysterious laboratories. In the Japanese military, bloodletting was associated with punishment or ritual suicide, not healing. To have blood extracted so methodically, so carefully preserved, suggested purposes they could not fathom. The thoroughness of the examinations astounded them. Every wound was photographed, measured, and documented. Tropical ulcers that had festered for months were examined under magnifying glasses. Malnourished bodies were weighed, and their measurements recorded on detailed charts. The Americans seemed obsessed with cataloging every aspect of their physical condition, as if each prisoner were a specimen worthy of scientific study rather than a defeated enemy. Most shocking was the discovery that the examinations were followed by treatment. Infected wounds that would have meant amputation or death in Japanese field hospitals were cleaned with solutions that stung but healed. Bandages made of soft, white cloth replaced the dirty rags prisoners had used to bind their injuries. Medications were distributed in small paper cups. Pills that dissolved on the tongue with bitter chemical tastes unlike any medicine they had known. The cultural collision was profound. Japanese military medicine operated on principles of endurance and acceptance. Soldiers were expected to bear pain silently, to view suffering as a test of character. Minor injuries were ignored until they became life-threatening, and even then, resources were too scarce for comprehensive treatment. Here, enemy hands touched them with clinical care, treating wounds their own medics had dismissed as insignificant. The realization dawned slowly that these examinations were not preparation for torture or execution, but genuine attempts to heal. The Americans invested time, resources, and expertise in restoring the health of men who had recently tried to kill them. It was a paradox that challenged everything the prisoners understood about warfare, about enemies, about the nature of medical care itself. The white pills arrived in small paper cups, each one no larger than a grain of rice, yet carrying within them a power that seemed to defy the natural order of death and decay. Private Tanaka lay on his cot, his left leg swollen to twice its normal size. The flesh around his shrapnel wound blackened with infection that had spread like poison through his blood. For 3 weeks he had watched the rot advance, accepting that death would claim him as it had claimed so many of his comrades in the Pacific jungles. The American medic approached with quiet confidence, speaking words in English that the translator rendered as instructions to swallow the medicine twice daily. Tanaka stared at the tiny white tablets, certain they contained poison, designed to end his suffering quickly, rather than let him waste away slowly. He had seen men die from infections exactly like his, their bodies consumed by fever until they thrashed and screamed before falling silent forever. Death was the natural conclusion to such wounds. Yet 3 days after beginning the mysterious treatment, something impossible occurred. The angry red lines that had crept up his thigh like poisonous vines began to fade. The swelling subsided, and the blackened flesh around his wound took on a healthier hue. By the end of the first week, Tanaka could move his leg without crying out in agony. By the second week, he was walking tentatively around the barracks, touching the healing skin with wonder and terror. The medics called it penicillin, a word that held no meaning in Japanese but carried the weight of resurrection. Prisoners whispered the foreign term to each other, rolling the syllables around their tongues like an incantation. They had witnessed what could only be described as magic medicine that could halt the advance of death itself, that could reverse the rot and corruption that had always been accepted as inevitable. Across the camp, similar miracles unfolded daily. Corporal Yamamoto, whose infected lung wound had left him coughing blood for months, found his breathing clearing after a course of the white tablets. Sergeant Ishida, delirious with fever from an abdominal infection that should have killed him, returned to lucidity within days of beginning treatment. Men who had been carried into the infirmary expecting to die emerged walking on their own feet, their bodies restored by medicines that seemed too powerful to exist. The prisoners struggled to comprehend this revolution in healing. In the Japanese military, their understanding of medicine was rooted in traditional herbs, spiritual strength, and the acceptance of suffering as a test of character. Infected wounds were treated with sake when available, or simply left to heal naturally if the gods willed it. Most did not heal. Most killed slowly, painfully, while comrades watched helplessly and accepted death as the honorable conclusion to injury. The concept that tiny pills could accomplish what prayers and willpower could not challenged the very foundation of their medical understanding. Some prisoners initially refused the medication, convinced that accepting help from the enemy would weaken their spiritual resolve. Others suspected the Americans were conducting experiments, using Japanese bodies to test dangerous chemicals that might have unpredictable effects. But the evidence was undeniable. Men who should have been corpses walked among them, their wounds closed, their fevers broken, their bodies restored to health. The antibiotics worked with mechanical precision, targeting infections with a specificity that seemed almost supernatural. Unlike the herbal remedies of traditional Japanese medicine, which required faith and patience, these Western drugs produced results that could be measured in hours and days. The psychological impact was profound. Prisoners who had accepted death found themselves confronting an unexpected future. They had prepared their minds for honorable endings, had written mental farewell letters to families they would never see again. Instead, they were forced to reconsider what was possible, to acknowledge that their captors possessed medical knowledge so advanced it could reverse the irreversible. Stories spread through the camp of the dying who had been restored. Men compared their recoveries, marveling at the speed with which infections yielded to American medicine. They spoke in hushed tones of comrades who had suffered identical wounds in the field, who had died slowly and agonizingly because such miraculous treatments had not been available. The contrast was stark and undeniable. What the Americans considered routine medical care surpassed the most advanced healing their own army could provide. The gratitude was complicated by shame. To owe their lives to the enemy created a debt that had no precedent in their understanding of warfare. Bushido taught that capture was dishonor, that death was preferable to the humiliation of defeat. Yet here they were, not only alive but healthier than they had been in years, restored by the very people they had been trained to hate. As the days passed and more prisoners experienced the power of antibiotics, a quiet revolution occurred in their understanding of medicine, of warfare, and of the enemy they had fought. The white pills had done more than heal their bodies. They had shattered their assumptions about American brutality and revealed a civilization capable of extending mercy even to those who had sought its destruction. The seriously ill were moved to a place that defied every expectation of military medical care. The hospital ward gleamed with white surfaces that reflected electric lights, creating an environment so clean it seemed sacred. Real beds lined the walls, not the straw mats or wooden planks that Japanese soldiers knew as medical accommodations, but actual mattresses with springs that yielded to the weight of broken bodies, covered with sheets so white they seemed to glow. Lieutenant Sasaki, burning with fever from dysentery that had ravaged his digestive system for weeks, was lifted onto one of these beds by gentle American hands. The mattress enveloped him like a cloud, so different from the hard surfaces he had endured throughout his military service. Clean sheets, changed daily by efficient nurses, wrapped around his weakened frame with a softness he had forgotten existed. The pillow beneath his head was thick and comfortable, a luxury that no Japanese military hospital had ever provided. Privacy curtains could be drawn around each bed, creating intimate spaces where prisoners could suffer or recover, away from the constant observation of guards and fellow captives. This concept of medical privacy was revolutionary to men accustomed to communal suffering, where wounded soldiers lay in rows on bare floors, their groans and final breaths witnessed by dozens of comrades. Here, curtains offered dignity even in illness, a recognition that healing required more than just medicine. The nurses moved through the ward with professional competence that astounded the prisoners. These were women, a fact that initially shocked men raised in a culture where medical care was provided by male doctors or rough military medics. Yet these American nurses demonstrated knowledge and skill that surpassed anything the prisoners had witnessed. They checked temperatures with precision, administered medications on careful schedules, and monitored symptoms with scientific attention to detail. Throughout the night, nurses made regular rounds, their soft-soled shoes whispering across the polished floors as they checked on patients. This concept of round-the-clock medical supervision was unprecedented in the prisoners' experience. In Japanese military hospitals, wounded soldiers were often left unattended for hours, expected to endure pain silently, until morning brought the possibility of treatment. Here, help was available at any hour, summoned by the simple act of raising a hand. Meals arrived on metal trays, carefully planned to aid recovery rather than simply provide sustenance. Prisoners recovering from surgery received broths and soft foods that would not strain healing digestive systems. Those with specific conditions found their diets adjusted to promote healing: extra protein for wound recovery, bland foods for stomach ailments, vitamin supplements to combat deficiencies caused by months of poor nutrition in the field. Pain medication was distributed with the same systematic care as antibiotics. Prisoners who had been taught to view pain as a test of character, who had been trained to endure agony without complaint, discovered that suffering could be reduced through careful application of analgesics. The relief was both physical and psychological. Not only did their bodies hurt less, but they realized that unnecessary pain was not a virtue in American medical philosophy. The beds themselves featured adjustable mechanisms that allowed patients to raise their heads or elevate their legs for comfort. This attention to patient comfort during recovery contrasted sharply with Japanese military medicine, where wounded soldiers lay flat and motionless until they either healed or died. The ability to adjust position, to find comfort during the long hours of recovery, represented a fundamental difference in medical philosophy: the belief that comfort aided healing rather than weakened character. Temperature control maintained the ward at a consistent, comfortable level, regardless of weather outside. Prisoners who had endured tropical heat and bitter cold during their military service found themselves in an environment designed specifically for human comfort. The steady warmth, neither too hot nor too cold, allowed their bodies to focus energy on healing rather than simply surviving environmental challenges. Even the most senior Japanese officers, men who had enjoyed the best medical care their military could provide, admitted privately that they had never experienced anything approaching this level of comprehensive patient care. The systematic attention to every aspect of recovery, nutrition, comfort, medication, monitoring revealed a medical system so advanced and well-resourced that it challenged their understanding of what was possible in the treatment of illness and injury. They were receiving care that exceeded what most Japanese civilians could expect from their own hospitals, delivered by an enemy that had every reason to let them suffer and die. The operating room was a temple of steel and glass, illuminated by lights so bright they banished every shadow. Captain Nakamura lay on the table, his abdomen torn by shrapnel that had festered for months, watching American surgeons prepare with ritual precision. Their hands moved with practiced efficiency, arranging instruments that gleamed like religious artifacts, each tool designed for a specific purpose in the ceremony of healing that was about to unfold. The anesthesia mask descended over his face like a gentle cloud, delivering gases that carried him into unconsciousness with a smoothness that defied comprehension. In the Japanese military, surgery meant biting down on leather straps, while crude instruments cut through flesh and bone, the patient's screams echoing through makeshift operating tents. Here, oblivion came peacefully, painlessly, administered with scientific precision that ensured complete unconsciousness throughout the procedure. When Nakamura awakened hours later, the infected mass that had been slowly killing him was gone. The surgical incision, closed with neat stitches that formed precise lines across his abdomen, was already beginning the process of healing. The pain that had tormented him for months had been replaced by a manageable soreness that medications could control. He touched the bandages in wonder, hardly believing that such extensive surgery could be performed without the brutal agony he had expected. The operating theater itself represented a level of medical sophistication that challenged everything the prisoners understood about battlefield medicine. Steam sterilization ensured that every instrument was free from contamination. Electric lights provided illumination that made precision work possible, even in the deepest cavities of the human body. Monitoring equipment tracked vital signs throughout the procedure, alerting surgeons to any changes in the patient's condition. Sergeant Harada, whose leg had been mangled by a grenade explosion, experienced the miracle of reconstructive surgery that saved a limb destined for amputation. American surgeons spent hours carefully repairing damaged blood vessels, reconnecting severed nerves, and rebuilding bone structure with metal pins and plates. In Japanese field hospitals, such extensive injuries meant immediate amputation with a saw, performed quickly to prevent death from blood loss, often resulting in infections that killed patients within days. The post-operative care extended for weeks, with specialized nurses monitoring every aspect of recovery. Surgical wounds were cleaned and redressed daily, with sterile techniques that prevented infection. Physical therapy began as soon as patients could tolerate movement, with trained specialists guiding exercises designed to restore function to repaired limbs. Pain management continued throughout recovery, ensuring that patients could focus on healing rather than enduring unnecessary suffering. The Americans invested remarkable resources in each surgical case, treating enemy prisoners with the same meticulous care they would provide to their own wounded soldiers. Complex procedures that required teams of specialists, expensive equipment, and weeks of follow-up care were performed without hesitation. The message was unmistakable in American medical philosophy. Every human life possessed value worth preserving, regardless of nationality or allegiance. Private Yoshida underwent emergency surgery to remove a bullet that had lodged near his spine, threatening paralysis if left untreated. The delicate procedure required neurosurgical expertise that existed nowhere in Japanese military medicine. American surgeons worked for hours with microscopic precision, carefully extracting the projectile without damaging surrounding nerve tissue. The successful operation not only saved his life, but preserved his ability to walk, an outcome that would have been impossible under Japanese medical care. The philosophical questions raised by such comprehensive surgical intervention were profound. Why would an enemy nation invest such enormous resources in healing men who had recently tried to kill American soldiers? The time, expertise, and materials devoted to each operation represented a commitment to preserving life that transcended the boundaries of warfare. It suggested a medical ethics that valued human life above considerations of military advantage or revenge. Recovery rooms provided quiet spaces where surgical patients could heal without disturbance, attended by nurses who checked on them regularly throughout the night. The contrast with Japanese battlefield surgery, where patients were expected to recover quickly or die quietly without complaint, could not have been more stark. Here, healing was seen as a process that required time, attention, and resources, not a luxury to be hurried or ignored. As prisoners recovered from operations that would have been death sentences in their own military system, they grappled with the realization that their captors possessed surgical capabilities so advanced they bordered on the miraculous. The successful preservation of lives and limbs that Japanese medicine would have abandoned revealed a gap in medical knowledge and resources that seemed almost insurmountable. The American doctor who entered the quiet room carried no stethoscope, performed no physical examination, yet claimed to be a physician specializing in wounds that could not be seen. Major Takahashi sat across from this strange healer, a translator between them, struggling to comprehend how invisible injuries could be treated with the same scientific approach as broken bones or infected flesh. The psychiatrist spoke in gentle tones about nightmares, about the trembling that seized soldiers' hands without warning, about the way certain sounds could transport a man back to the moment when shells exploded around him. For Takahashi, these experiences were shameful secrets, evidence of spiritual weakness that no honorable warrior should acknowledge. In Japanese military culture, psychological trauma was viewed as cowardice, a failure of character that brought disgrace upon both the individual and his unit. Night terrors had plagued him since the bombing of his transport ship, dreams where he awakened screaming as phantom flames consumed his sleeping comrades. During his service, such symptoms were grounds for court-martial. proof that a soldier lacked the spiritual strength required for warfare. Officers who displayed signs of mental breakdown were quietly removed from command, their careers destroyed by the admission that their minds could not withstand the pressures of combat. The American psychiatrist listened without judgment, as the translator conveyed Takahashi's hesitant admissions about his fears, his inability to sleep, the way sudden noises made him dive for cover, even in the safety of the prison camp. Instead of condemnation, the doctor responded with understanding, explaining through the interpreter that such reactions were normal responses to abnormal experiences, medical conditions that could be treated, rather than character flaws that brought shame. This revolutionary concept challenged everything Takahashi understood about the nature of courage and weakness. The psychiatrist described trauma as an injury to the mind, similar to a broken bone or torn muscle, requiring treatment and time to heal properly. The idea that psychological wounds deserve the same serious attention as physical injuries contradicted the fundamental principles of Japanese military training, where mental strength was considered a matter of willpower and spiritual discipline. Sessions continued weekly, creating a safe space where prisoners could discuss fears they had never been permitted to acknowledge. Corporal Moto spoke of the guilt that consumed him over surviving when his entire squad had perished, a burden that manifested as crushing chest pains for which no physical cause could be found. The psychiatrist explained survivors' guilt as a recognized condition, offering techniques for managing the emotional pain that threatened to destroy him from within. The treatment involved no medications, no physical procedures, yet produced results that seemed almost miraculous. Prisoners who had not slept peacefully in months found their nightmares diminishing as they learned to process traumatic memories in new ways. Men who had trembled uncontrollably discovered relaxation techniques that calmed their overwrought nervous systems. The healing occurred through conversation, understanding, and the radical acceptance that psychological wounds were legitimate medical concerns. Group sessions brought together prisoners who shared similar experiences, creating communities of understanding that would have been impossible under Japanese military discipline. Men who had been trained to suffer in isolation discovered the therapeutic power of sharing their pain with others who had endured similar trauma. The collective acknowledgement of psychological wounds began to heal shame that had festered in silence for years. The contrast with Japanese military attitudes toward mental health could not have been more stark. Where their own system viewed psychological breakdown as disgraceful weakness, American military psychiatry treated it as an inevitable consequence of combat that required professional intervention. The recognition that trauma was a wound inflicted by war, rather than a failure of character, offered prisoners a new understanding of their own suffering. Some prisoners initially resisted the psychiatric treatment, viewing it as another form of interrogation designed to extract military secrets through psychological manipulation. However, the consistent focus on healing rather than information gathering gradually built trust. The psychiatrists demonstrated genuine concern for prisoner welfare, offering tools for mental recovery without demanding anything in return except honest participation in the therapeutic process. The revelation that Americans treated mental health with the same systematic approach they applied to physical medicine represented a fundamental shift in understanding warfare's true costs. While Japanese military culture insisted that strong spirits could overcome any psychological challenge, American psychiatry acknowledged that even the strongest minds could be wounded by experiences that exceeded human capacity to process normally. Morning inspection became a ritual of preventive care that astounded prisoners accustomed to medical attention only when injuries threatened immediate death. American medics moved through the barracks with clipboards and thermometers, checking each man for signs of illness before symptoms became serious enough to require emergency treatment. This systematic approach to health monitoring represented a philosophy entirely foreign to Japanese military medicine, where soldiers were expected to report for duty unless physically incapable of standing. The daily distribution of vitamins arrived with breakfast, small colored pills that prisoners learned to swallow without question after witnessing their effects on overall health and energy levels. Many had never encountered the concept that nutrition could be supplemented with concentrated nutrients, that deficiencies invisible to the naked eye could be corrected through careful administration of specific substances. In the Japanese military, malnutrition was accepted as an inevitable consequence of warfare, endured until it resulted in death or incapacitation. Vaccinations were administered with assembly line efficiency, each prisoner receiving injections designed to prevent diseases that had devastated Japanese forces throughout the Pacific Campaign. The Americans explained through interpreters that these shots would protect against typhus, cholera, and other infections that spread rapidly through crowded military populations. The concept of preventing illness before it occurred challenged the reactive approach of Japanese medicine, which focused on treating disease after symptoms appeared. Regular medical checkups occurred monthly, comprehensive examinations that tracked changes in health status over time, blood pressure measurements, weight monitoring, and detailed physical assessments created medical records more thorough than most Japanese officers had ever received during their entire military careers. The systematic documentation of health data suggested a medical philosophy that viewed early detection and intervention as superior to crisis treatment. Dental care represented perhaps the most shocking aspect of American medical thoroughness. Prisoners lined up weekly for oral examinations by trained dentists who cleaned their teeth with precision instruments and filled cavities with metal amalgam. Many had never experienced professional dental treatment, having endured toothaches and infections as unavoidable aspects of military life. The discovery that dental health was considered integral to overall medical care revealed yet another dimension of American medical sophistication. Medications for chronic conditions were distributed daily to prisoners whose long-term health problems had been ignored or inadequately treated during their military service. Men with digestive disorders received tablets that controlled symptoms they had accepted as permanent afflictions. Those with skin conditions found relief through topical treatments that addressed problems their own medics had dismissed as cosmetic rather than medical concerns. The camp medical dispensary operated like a small hospital pharmacy, stocked with hundreds of different medications for conditions ranging from minor headaches to serious chronic illnesses. Prisoners marveled at the variety and abundance of treatments available, contrasting it with Japanese field medicine, where a few basic supplies had to serve all medical needs. The systematic organization of medical supplies suggested resources so vast that even prisoners of war could access treatments unavailable to Japanese civilians. Physical therapy became routine for prisoners recovering from injuries, with trained specialists guiding exercises designed to restore strength and mobility to damaged limbs. This concept of rehabilitation medicine was revolutionary to men whose military experience suggested that wounds either healed naturally or resulted in permanent disability. The systematic approach to recovery maximized functional restoration rather than simply accepting whatever level of healing occurred spontaneously. Health education sessions taught prisoners about hygiene, nutrition, and disease prevention through translators, who explained American medical knowledge about the connections between lifestyle and health outcomes. These lessons covered topics never addressed in Japanese military training, such as the importance of regular exercise, balanced nutrition, and adequate sleep for maintaining optimal health. The systematic sharing of medical knowledge suggested a culture that viewed health education as a public responsibility. Mental health monitoring became as routine as physical examinations, with psychiatric staff regularly checking on prisoners who had experienced combat trauma or showed signs of psychological distress. This integration of mental health care into routine medical practice demonstrated American recognition that psychological well-being was inseparable from physical health, a concept that had no equivalent in Japanese military medicine. The transformation of camp health statistics provided undeniable evidence of the effectiveness of systematic medical care. Death rates plummeted, as preventive measures eliminated diseases that had previously decimated prisoner populations. Chronic conditions improved under consistent treatment regimens. Overall fitness levels increased as nutrition and medical care addressed deficiencies that had accumulated during years of warfare. Prisoners began to understand that this comprehensive medical system represented more than superior resources or advanced knowledge. It reflected a fundamental difference in how Americans valued human life and health, treating medical care as a systematic science rather than a collection of emergency responses to crisis situations. The contrast with their own military medical experience revealed gaps in philosophy and practice that extended far beyond simple resource limitations. Years after repatriation, former prisoners carried within them a wound that never fully healed, not of the body, but of the mind. They had witnessed medical miracles that their own nation could not provide, experienced healing that transcended the boundaries of war and hatred. In post-war Japan, when they visited doctors or hospitals, they inevitably compared the experience to those sterile American infirmaries where enemy hands had saved their lives. Some became advocates for modern medical practices, pushing Japan toward the adoption of Western medical techniques. Others remained silent about their experiences, unable to reconcile the shame of defeat with the gratitude they felt toward their captors' healing touch. But all carried the knowledge that they had glimpsed a form of medicine so advanced, so comprehensive, that it revealed the true scope of American power, not just in weapons or industry, but in the systematic preservation of human life. The antiseptic smell they had first feared became a memory of transformation, proof that even in the midst of total war, one civilization had chosen to heal rather than harm, to preserve rather than destroy. For those who lived it, the medical care they received in captivity remained not just a story of survival, but a revelation of what was possible when a society possessed both the knowledge and the will to treat every human being as worth saving.